Have you ever wondered if it's actually possible to increase penile length? Scientifically, not through myths or fake products. You've probably seen countless ads, miracle pills, and strange exercises online. But what's the truth? What does real medical science say about it? Today, we're going to uncover the scientifically proven ways to improve penile length and performance, backed by research, explained by urologists, and grounded in real anatomy and physiology. But before we begin, if you're serious about your health, confidence, and well-being, make sure to subscribe to our channel, Dr. Kayla Health Tips, where we bring you real, science-backed information that helps you become the healthiest version of yourself. All right, let's dive in. Beacon 1, understanding the science behind penile size. Before we talk about increasing size, it's important to understand what actually determines it. Penile length and girth are influenced by genetics, hormones during puberty, overall body composition, and circulatory health. The average erect length across studies is about 5 to 5.5 inches, and the average flaccid length around 3.5 to 4 inches. But here's something surprising. These studies show that most men underestimate their own size because of visual, perspective, and body fat distribution. Excess fat around the pubic area can make the penis appear shorter even when it's not. That's why one of the first scientifically verified ways to make it appear and function longer has nothing to do with surgery or pills. It starts with improving body composition and blood flow. Section 2. Lose weight, gain visible length. Let's start with something simple: weight loss. According to research from the University of Turin and Harvard Medical School, men who lose excess abdominal fat can gain a visible increase of up to 1 inch in penile length, simply because the hidden base of the penis becomes more exposed. When you gain fat, especially in the lower belly and pubic region, it forms what doctors call a fat pad. This fat pad partially covers the penile shaft, making it appear shorter. Losing that fat makes the base visible again. And that's real, measurable length you can recover naturally. So yes, the first proven method is fat loss through proper diet and regular exercise. And it's not just about looks. Weight loss improves testosterone levels, vascular health, and stamina, all vital for stronger, more confident performance. Section 3. Pelvic floor exercises, the secret muscle most men ignore. The pelvic floor muscles, especially the pubococcygeus muscle, play a key role in erection quality, control, and perceived size. In a 2005 study published in the British Journal of Urology International, men who performed pelvic floor exercises, also known as Kegel exercises for men, saw significant improvement in rigidity and function, which indirectly increased visible length and girth during arousal. Here's how you can do it safely. Identify the muscles used to stop urine mid-flow. Contract those muscles for 5 seconds. Then release for 5 seconds. Do 3 sets of 10 reps daily. With consistency over a few months, your erections become firmer, longer lasting, and visually larger due to better blood trapping in the tissue. So the second proven method is strengthening your pelvic floor. Section 4. Hormonal balance, the role of testosterone and growth factors. Another scientific factor is hormone balance. Testosterone influences penile tissue health, libido, and performance. Low testosterone, known as hypogonadism, can cause shrinkage of both penile and testicular tissue over time. If you suspect low testosterone, symptoms like fatigue, reduced desire, or loss of morning erections, consult a certified urologist or endocrinologist. They can check your blood levels and, if necessary, recommend safe medical therapies. But never self-medicate with online hormone boosters. These can harm your heart, liver, and fertility. Along with medical guidance, natural testosterone support includes getting 7-8 hours of quality sleep, doing resistance training or HIIT, managing stress, eating zinc-rich foods like pumpkin seeds and eggs, maintaining a healthy weight, balanced hormones, better tissue health, better function and appearance. Section 5. Medical and surgical procedures, what's actually proven. Now let's get to the part most men are curious about. Are there real medical ways to increase penile length? There are, but they come with clear guidelines and risks, and must only be done under the care of a board-certified urologist. 1. Penile traction therapy, PTT. Penile traction devices are FDA approved for conditions like Peyronie's disease and for post-surgery recovery. Clinical studies, such as those published in the Journal of Sexual Medicine, they show that daily traction, under medical supervision. For several months can lead to a gain of 0.5 to 1.5 inches in some patients. The mechanism is simple, gentle. Consistent stretching stimulates tissue remodeling, similar to how braces align teeth over time. But again, this must be done correctly, safely and consistently, ideally with professional monitoring. Penile surgery. Surgery is considered the last resort and is rarely recommended unless there's a medical condition like micropenis or severe curvature. Procedures like ligament release or fat transfer can slightly increase visible length, but they carry significant risks: scarring, nerve damage, or reduced sensation. That's why urologists emphasize that surgery is not for cosmetic curiosity but for medical necessity. Section 6, What doesn't work? Myths and marketing lies. Let's bust a few common myths. Magic pills or herbal oils? No clinical evidence supports these. Most are unregulated and may harm your liver or heart. Vacuum pumps. These can temporarily increase blood flow, but results fade after a few hours. Long-term excessive use may even cause injury. Stretching or jelqing. Internet famous but medically unsafe. Urologists warn these can cause tissue damage, bruising, or fibrosis. If something promises instant inches in a week, it's not science. It's marketing. Section 7. Psychological and relationship. Factors. The hidden power of confidence. Here's something few people talk about. Size anxiety often has more to do with perception than reality. A 2019 study from King's College London found that most men who worried about being too small were actually within the normal range. Confidence, communication, and mutual satisfaction play a far bigger role in intimacy than size ever will. When men take care of their physical and mental health through fitness, proper nutrition, mindfulness, and open communication, their relationships and self-image improve dramatically. Remember, confidence is magnetic. Section 8. Lifestyle habits that support penile health and function. Let's summarize the real lifestyle habits that maintain or slightly enhance size and performance naturally. 1. Stay active. Regular cardio and strength training improve blood circulation, which directly affects erection quality. You eat smart. Foods rich in antioxidants, like berries, spinach, and pomegranates, improve vascular function. Avoid smoking. Nicotine constricts blood vessels and reduces nitric oxide, essential for erection quality. Limit alcohol. Excess alcohol can suppress testosterone and nerve sensitivity. 5. Sleep well. Growth hormone and testosterone peak during deep sleep. 6. Hydrate. Blood is 90% water. Dehydration can lower performance and sensitivity. Healthy body, healthy blood flow, healthy function. It's all connected. Section 9. Final thoughts. The real truth about penile enlargement. Here's the truth that science has proven over and over again. While there's no miracle trick to permanently add inches overnight, there are ways to improve visible length, firmness, and function through healthy living, weight management, pelvic training, and evidence-based medical options when appropriate. Real improvement doesn't just come from external methods. It comes from internal change, better blood flow, stronger confidence, and smarter habits. Outro. Wrap up with authority and positivity. So, to every man wondering if it's possible, yes, there are scientifically proven ways to improve what nature gave you. But it starts with health, not hype. If you found this video informative, don't forget to subscribe to our channel, Dr. Kayla at Health Tips, for more science-based guidance on men's health, hormones, nutrition, and performance. And remember, this content is original, informative, and designed purely for educational purposes. Always consult a qualified healthcare provider before trying any medical treatment or device. Take care of your health, your confidence, and your mind, and your body will follow.